This area. So those were areas that I found. We kind of want to address everything that's around the shoulder. And I'm going to go along the collarbone here. Hey guys, Dr. Will here from Miami Spine and Performance in Hallandale Beach. We're here with Dr. Eric, another fellow chiropractor, another fellow Chicago guy, so really happy to have him here. Last time that he was in here, we gave him an adjustment, so we looked at what joints were moving, what joints weren't moving, and we went ahead and got him adjusted. We're now going to complement last treatment with some soft tissue work. So as you guys know, being a sports chiropractor, I do tons of soft tissue work, probably just as much of that as I do adjusting. So we're going to get in with Dr. Eric today. We're going to open up his chest through here, shoulder, upper trap, and kind of just unlock this whole right shoulder. He's obviously a very muscular guy, so we're going to have to bring out some of the heavy-duty tools today. So we're going to be working with our instrument-assisted tools here. I'm going to start with this one, and if we need to bring out the old handlebar, so be it. Then we'll finish up with some cupping, make sure we get some blood flow in there, and I'll have Dr. Eric just do some shoulder movements to wrap up treatment. Okay, so let's get started. So we're going to start here, just kind of put a little of this down. This will just help the tool glide a little bit better. Again, really focusing on the front delt mostly, kind of the tie-in with the pec here to start.
So Doc, what kind of lotion is this?
This is Albaline Moisturizing Cleanser. So I don't use a very specific like massage oil or anything like that. I think this is actually a makeup remover. So shout out, but I found this to be really good, and most importantly, it doesn't really it's not sticky on the skin, so it's really easy to get it off. So patients do not want sticky stuff on their skin. I do not want it on my hands, so we go with the simple option here.
Yeah. And this is mainly add some friction, but not so much, right? Just to make sure it's...
Yeah, just to make sure the tool glides smoothly. There's a couple different schools of thought on these tools. I tend to be a little bit more conservative, so I'm not looking to draw blood here during this visit, but I am looking to get some therapeutic benefits. So there's always a chance that there might be a little bit of redness, but we're really just trying to get in there, provide some sensory stimulation to the area, and just kind of break up any knots, adhesions that have built up in the muscle from working out. Okay, so I'm going to start with the sharp edge here, more superficial, and kind of come down through the front delt. Just go ahead and relax your arm as much as you can here. So what I'm trying to do here is I'm really kind of working the insertion of the pec and the front delt, right? So the pec and the front delt kind of overlap, attach into the shoulder like this. And I'm trying to follow the contour of the muscle fibers as well. And I'm going to go along the collarbone here. Yeah, so I'm feeling for grittiness mostly, so I can feel different textures, right? Like through here, through these intersectional areas, it's just not very smooth. And so I'll just kind of run the tool through there and try to smooth that out. So the number one thing we're looking for is texture, right? Number two, we're asking the patient, where are you feeling discomfort and things like that. But usually, I've been doing this long enough that I can kind of, I can close my eyes and just let my hands do the work and tell me everything that I need to know. It also helps to know your anatomy. So all you young students out there, know your anatomy. Then you can be a good clinician. So I'm going to come all the way through the side delt here. Again, I'm really focusing on transitional areas. So where the front delt and the side delt interact right through there, I'm going to just take the head of my tool and brush it down through there, kind of short, choppy strokes.
So for those of you that are wondering if this is for you, so on my right side, I tend to sleep on my right side, even though I shouldn't be. So it tends to roll in more anterior forward, creating some lateral pain, so pain in my shoulder on the right side. And then it also makes that shoulder look smaller because now my pec's contracting majority through the night. So Dr. Will noticed that right away. So we decided to work more on the right shoulder and create more of that symmetry, because obviously in my sport and then just obviously in health, you want to be more symmetrical. So he noticed that. So he is again working on where the pec goes into the shoulder over there in that area. So it'll release to help my shoulder be in the right position to keep me further away from injury as well. So as he's feeling it, I just let him do his magic. I'm sure, like he said, he could put a blindfold on, but he's feeling those little knots and bumps. So if you attempted to do something like this at home, obviously I would suggest, which he would probably too, have a professional do it, because then you know how much tension to put in. But you'll see if you do this, come here, you'll see his technique is very, very good. This is not as painful. I've seen a lot of people just get destroyed. I'm sure you have too, right?
Oh, yeah.
people just going in trying to bleed you out like a vampire with these tools, and that's not what needs to happen at all.
Yeah, I mean, I've had people do this on their own and, cause scabs and burns and all kinds of stuff. So, like I always say, leave it to a professional. We can be much more efficient with it. There's other tools, things like foam rolling, which are just kind of much safer to do at home, much less downside, stretching, exercising. But when it comes to these stainless steel tools, generally better to keep it with a professional. So now I'm going through the upper trap here. And again, obviously, the upper trap, yeah, we typically think of it as sort of a neck muscle, but it does kind of come down and attach right near the AC joint here. So we kind of want to address everything that's around the shoulder and kind of give us the best chance of success here. So I'm just going up and down, following the contour of the fiber. Remember, guys, the upper trap is only 1/3 of the trapezius muscle. The whole muscle itself goes all the way down to the thoracolumbar junction. So it's a big muscle, but the upper trap is the one that tends to cause the most issue for people. So now I'm going to get to some of these sticky spots, bringing out the old handlebar tool. I know you guys love this one, so I'm going to work on Dr. Eric here, especially you CrossFitters. I know you're always looking for us to bring this one out. So just going to come down. Just allows us to get a little bit more surface area. Doc, if you could just drop your head a little to the left there. Yeah, so allow him to get a little stretch there as well. And I'm feeling, as I scan with the tool, I'm feeling a couple little knots in here, a couple little bumps. So we're just going to kind of scan through that area, following the contour of the muscle. We're not going over bone or anything like that. Just keeping it nice and comfortable.
So what would you say the patients normally say that they have that's going to trigger you to think that you should degrass them?
Yeah, so usually I'm looking at someone that's having muscle ache or muscle stiffness, but a lot of times if it's a sports or workout related injury, right? So if it's a CrossFit thing, if it's someone that injured themselves at the gym or someone that injured themselves during their sport, odds are we're going to want to get in there and do some muscle work with the tool, right? And a lot of times I'll do ART and the tool cupping. I'll use a couple of different things in there. Like here, I'm just kind of getting in. There's a little knot through here that I'm just kind of putting a little bit of pressure on. Just getting all this worked out here. And now we're even getting into the rotator cuff here, the supraspinatus. So again, this can really be used for everybody. It's very, very safe, very effective. So I do use it all the time with patients, depending on what they come in with. So we're going to get a little bit of this off of Doc here, and then we're going to follow it up with a little bit of cupping. And I'll tell you guys a little bit about what cupping does, because I know, again, it's a really popular thing, but not everybody maybe understands what's going on with the cupping, why is it causing those dark marks and everything like that. So as I put the cups on Doc here, I'll walk you guys through kind of my thought process.
As he's getting ready for that, any of you that with questions, drop them in the comments below. He will respond back and tell you his take on it. And two, if you have any specific questions, just shoot him an email and such. You can find his information on his website.
Yeah, absolutely, guys. We love comments, DMs. We love to interact with you guys, so let us know. All right, so I'm going to start. I'm going to put some cups on the upper trap here and then a little bit on the delt. So I'm going to put the cup down, give it a couple pumps. You okay there? Comfortable?
Yeah.
No problem. So generally you feel just kind of a little bit of a suction, but no discomfort or anything like that. And what you notice is as you put the cup in, you'll see kind of the skin bubble up and you'll see some discoloration. So what's happening there is as I place this cup on Doc here, it's creating suction and it's pulling the skin and the muscle, pulling the skin, the muscle, and the fascia up. And so it's allowing his blood vessel to dilate. And what that does is it allows for more blood flow to the area, which is going to improve healing. It's going to bring oxygen. It's going to bring nutrients and everything like that. So it's a way to, when you have stiff muscles and you're not getting good blood flow, this is almost a little way for us to cheat and open up the vessels so that we can get some more healing in there. So it's a super powerful tool. It's actually been around for thousands of years, so it's nothing new and innovative. It's from Eastern medicine, but we use it a lot here in chiropractic and here at Miami Spine and Performance. So.
That's one of the things that I like to point out to people is like increasing blood flow, right? Because if you think about a tissue, what does it need? It needs nutrients, it needs oxygen, it needs vital things that the blood supplies, right? So if you have a knot or if you have some type of restriction that's not allowing blood flow to get there, how is it supposed to heal, right? This guy's like a ninja. He's finding like all the spots just from how I'm sitting.
Yep. Yeah, so you guys will notice I'm putting a lot of the cups back here, right? Well, we're trying to get some blood flow and activation to these rhomboids, to the rotator cuff, to the posterior delt. Since we just went in and stripped this out, we're going to go ahead and try to get some blood flow back here as well. What I'm going to have Doc do is I'm just going to have you kind of bring your arm across like so a couple of times for
So
me.
lift it up.
Yeah, lift it up and just bring it across your midline. Good. Bring it back. We usually lose one along the way. No big deal.
Yeah, I can feel that like stretch.
Yep. So this is just another way to improve blood flow. Again, kind of make the cups a little bit more functional rather than just laying there and having them work. We always want to try to incorporate some of your own movements, so that way your body's going to download kind of the new pattern and the new blood flow. Yep, get some rotation in there as well. That's good. Oh, lost another one. That's why I use plastic cups and not glass cups for this kind of stuff.
That's true. That's true.
We do use glass cups and fire cupping, but that's more for when we do acupuncture. For sports cupping like this, just stick to the plastic ones. Give me a couple more rotations, external rotation. Good.
That one seems to be my tough spot.
Yeah. Good. And relax. Good. Nice. And it's usually a good sign when we see those dark circles because it means that we're working in an area that was previously deprived of blood flow, right? So when you get a strong reaction, it's good. So Doc, if you want to turn a little bit, you can see here, right, we've got this area, this area, this area. So those were areas that I found that you know, there was some gritty tissue under there, maybe a little bit of scar tissue, and so we're able to get some blood flow with the cupping, and that way he's going to feel a lot better next time he goes to work out. He's going to just feel more mobility and more health in those shoulders. So thank you guys for watching. Again, if you have any additional questions about Graston, cupping, chiropractic, anything like that, you can ask myself, Miami Spine and Performance. You can ask Doc here. Is it Fit for Life?
Fit for Life Doc, yeah.
Fit for Life Doc.
He's the pro at this. He does the cupping, he does the soft tissue,
Yeah.
So look him up. But if you do have any questions, hit me up on my Instagram or my YouTube, and I can direct you to him.
Yep. Thank you guys. Take care. Have a good one.
See you next video.